Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Simon Mortlake. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Now, Mr. Mortlake, I think you've been referred by your GP. I've got your notes here, but perhaps you can tell me in your own words what seems to be the problem. What's brought you here today?
Sure. Well, it's not the first time I've been to this clinic. I was referred to one of your colleagues about 3 years ago. I had what I thought was a stomach ulcer, which had been troubling me for some time, and my GP suggested I came in for tests. And I had what he called an endoscopy, you know, where they put a tube down your throat and have a look at your insides. And as part of that, they also did a biopsy to make sure it wasn't something more serious.
That's right, and that was clear.
Yes, it was, fortunately. I actually had a condition called Helicobacter pylori, and I went on a course of tablets for that.
Right.
It was cleared up in no time, very straightforward. But the consultant did say that I needed to be alert for any further symptoms. You know, that there's a greater risk of cancer developing after you've had that, and that I should come straight back if I had any problems.
Oh, indeed. And have you had any other medical problems since then?
Well, a couple of years back I had a hernia operation. That was also very straightforward. I had that done just after I retired. I expect it was actually an occupational injury of some kind because quite a few of my colleagues have had similar problems.
Okay.
I was a police officer for most of my working life. Other than that, I keep relatively fit. I'm not taking any medication for anything. I've been well until just recently.
Okay. So what's happened to change that?
Well, I've started to suffer from indigestion, particularly after lunch or dinner. I get heartburn, you know, pain just here.
I see. And are there any other symptoms?
Well, I've also found myself running out of energy. I'm a keen gardener, and I'll be digging or whatever, and suddenly I feel a need to take a rest. I mean, that's not like me. I usually want to finish a job once I've started it, you know. But if I try to push myself too much, I start to get breathless, and that's a bit worrying, to be honest.
I see. And are you aware of your weight changing at all?
Not really. But what I have noticed is that I just don't seem to have such a good appetite anymore.
Right.
I mean, that's partly being retired, I'm sure, but I do keep pretty active. It's just that I don't fancy the sort of big meals I used to eat. I start to feel sick if I have too much.
And are there any other pains or physical symptoms?
Not really. I've been looking out for things like my stomach swelling up, because I know that might be a symptom of something. But to be honest, I can't say I've ever had that.
So what do you think might be the problem?
Well, the thing is, my uncle, that's my mum's brother, he had to have a gastrectomy. And I remember this is how it all started. I mean, the symptoms I've described, and, well, I think these things can run in families, can't they?
Well, they can.
Anyway, the real reason that I want to get checked out is because I've got a big trip coming up. The wife and I have booked tickets on a cruise to Antarctica. I mean, it's the trip of a lifetime. We're really excited about it, but I need to make sure I'm well.
Okay. Well, I understand your concern. So what I need to
Hello, I'm Julian, one of the nurse practitioners here. How can I help you?
Well, Julian, I've got some pain in my sort of the lower part of my tummy, actually.
Right. Okay. And have you noticed any other symptoms apart from that abdominal pain?
Well, the pain's there sort of on and off, but then when I have a wee or go to the loo, it really hurts.
Right. It hurts when you go to the toilet. Right.
Yeah.
Okay. And how long have you had that abdominal pain for?
I think it's been about a week, really.
Right.
Sort of on and off, not all the time.
For about a week. Okay. What's about the pain when you pass urine? How long has that been for?
I suppose towards the end of the week, and then really over the last 3 days, that seems to have got worse.
Right.
And now it feels like if I, as soon as I need to go to the loo, I've got to go. I feel a real urgency to go, and it seems like I'm going to the toilet more often.
Right, okay. So some pain passing you in the last few days, and then more recently had to go to the toilet more often,
Yeah.
and you feel like you've got to go all the time.
Yeah. And in the night I now have to wake up and go to the loo.
Right, you have to get up at night as well. Okay. All right. Have you had any problems like this before? Any this type of urinary problems?
I suppose I had something sort of similar, about 2 years ago actually.
Right.
And it sort of felt quite the same.
Right, and can you remember what that problem was?
I think they said I had cystitis.
Right.
Yeah, cystitis, and I had to have just some antibiotics.
Oh, some antibiotics, okay. And did it go away then?
Yep, it went away, and I don't think I've had anything since.
Right, okay, fine. Have you still got the abdominal pain at the moment?
Yes.
Okay.
Not too bad,
Not too bad.
but it's there.
Okay.
It's just sort of in the background.
Okay. Is it there all the time, or does it go up and down?
I think it goes up and down really, but worse perhaps when I am having a wee.
Okay. On a scale of 1 to 10, with 10 being the worst, how would you rate the pain?
It's not that bad. I think it's probably about 4.
About 4.
3 or 4.
Okay, so not so bad. Okay. Have you taken any medicines at all for this problem?
Well, I did take a couple of paracetamol,
Okay.
and that seemed to help with the pain, but obviously it doesn't stop me needing to go to the loo all the time.
Right. And it helped with the pain a bit. Okay. Good. All right. Now, I just wanted to ask about some other symptoms related to this. Have you had any fever at all, like feeling hot?
No.
No. Have you felt sick at all?
No.
Okay. Have you noticed any blood in the urine?
Oh, no.
No. Okay. That's
Should
good.
I?
Well. If you did, then we'd want to do something
Oh,
about
no.
it. If you haven't, that's fine. Okay. And have you noticed any unusual vaginal discharge at all?
No, just the same really.
It's the same. Okay. And any unusual vaginal or vulval irritation or spots or sores since you've had this problem?
No, just the sort of pain that feels like it's inside when I'm having a wee, but I haven't noticed anything. So.
Okay, fine. Okay, and do you have a partner at the moment?
Yeah, I'm married. Been married 5 years nearly.
5 years, okay. Right. When did you last have a sexual health screen?
I think it was, when before we started going out with each other, so as we were going out, which is probably about 6, 7 years ago.
Right, okay. All right, fine. And I need to ask this question in relation to possibility of sexually transmitted infections, but have you had any other sexual contacts
No,
recently?
I haven't.
No. Okay.
Oh,
Well,
maybe my husband has.
okay. Well, we're just checking to see if there's any risk for sexually transmitted infections. Okay, that's fine. And I just need to ask about your period as well. When was the first day of your last period?
What day is it today? About 2 weeks ago.
2 weeks ago. Okay, was that as normal, do you think?
Normal.
Do you think
No
there's
problem.
any risk of pregnancy?
No, because I have an implant.
Right, okay. Fine, okay. That's all right. Now, so how often would you say you're going to the toilet during the day?
Oh, it feels like I could go every 5 minutes,
Right,
really.
right.
I don't know.
Okay.
Quite more than I would normally go.
Right, okay. And have you been able to go to work, or you have to take time off?
Well, since it's now feeling like I might wet myself if I don't get to the loo
Right.
quick enough, I've taken the last 2 days off.
Right.
just because I work in a really busy office and I can't bear the thought of that happening at work.
Okay, fine, all right. Okay, so you've mentioned that you've had cystitis before in the past and you had some antibiotics for that.
Yeah.
I just want to ask about some past medical history problems. Have you any other illnesses or operations in the past that I should know about?
No, nothing really. I've always been really healthy. I mean, I had this sort of cystitis thing 2 or 3 years ago.
Okay. All right, fine. Okay, so I just wanted to ask about medicines as well. You mentioned that you're taking paracetamol
Yes.
for this problem, and that got an implant as well. Do you take any other medicines?
No, I mean, sometimes I might take ibuprofen if I need
Right.
to, but nothing regular.
Okay,
No.
fine. And are you allergic to any medicines
No.
you're aware of?
No,
No. Okay.
not that I found out.
Fine. And what sort of job is it?
I work in an office, but I'm just a secretary.
Right, you're secretary in an office.
Mhm.
Okay. And you're married. Have you got any children?
No.
No. Okay. All right. And just thinking about your weekly alcohol intake, how much do you think you would drink normally?
Not very much really. Probably a couple of glasses a week.
Right.
Sort of just depending on what's going on, but most weeks probably minimal.
Right. Okay. Okay. Good. And what about smoking?
Well, I've been really good. I
Yes.
used to smoke.
Oh, okay, yes.
I think 3 years ago now I stopped and I haven't smoked
Right.
since.
Okay. Oh, that's good. That's good. Well done. Okay. And what about exercise? You take any exercise?
On a Monday night after work I go swimming.
Yes.
And I do walk my dog sort of
Right.
2-3 times.
Okay. Yes, that's good.
But nothing else.
All right. That sounds okay. All right. And have you had any travel anywhere recently, say outside of the
No.
UK?
We're going in a couple of months, but we did actually go. I think our last holiday we just went to Ibiza last summer.
Okay. Fine. So nowhere exotic, really. Okay. And what were you thinking this problem might be? Did you have any thoughts?
It seems very similar to what I had a couple of years ago, really. So I think maybe I've got cystitis or a urine infection.
Oh, right. Okay. Yes, it does sound a bit like that, doesn't it? Yes. Okay. And what were you thinking to do about the problem today?
Well, as it worked so well before when I had the antibiotics, I thought maybe I should have some antibiotics because it doesn't seem to be getting better.
Yes.
It's
Yes.
getting worse, really.
Okay. Fine. All right.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
You hear a physician talking to a group of trainee doctors. Now, read the question.
Honeybees have barbed stingers that are left behind in the person's skin after the initial sting. If the stinger is removed by pinching the stinger, more venom is actually injected, so it's better to remove the stinger by gently lifting it using a pair of tweezers to remove it from the skin. Generally, honeybees aren't aggressive and only sting in self-defense. However, in some cases, a person will disrupt a hive or swarm of bees and get stung multiple times. If a person gets stung more than a dozen times, the accumulation of venom may induce a toxic reaction and make them feel quite sick. And multiple stings can be a medical emergency, especially in children, older adults, and people who have heart or breathing problems. So make sure to check with the patient and be aware of the signs of multiple stings.
Listening Part B. You hear two dentists discussing a patient. Now read the question.
I've just seen Mr. Butler, one of your regular patients. He's been in some pain recently.
Right. I've been fully booked for the past few weeks, and he told reception he couldn't wait any longer. He's had chronic periodontitis for some time now, but I gather it's worse.
Yes, I provided thorough curative treatment in all quadrants today, but his gums were in such poor condition and there was severe mobility in his lower right first and second molars, so I had to extract them. I've scheduled him for implant surgery, but I'm worried about his broader health issues and whether or not he's been taking biphosphonates. I couldn't find any information in his records about it.
There isn't any, no. You may have to contact his GP.
Okay, I certainly want to reduce the risk of any osteonecrosis after surgery. Listening Part B. You hear an optometrist giving a presentation to a group of teachers. Now, read the question.
About 1 in 12 boys is colourblind, and 1 in every 400 girls. So in each school class there are likely to be at least 1 or 2 students who are colourblind. Because they are colourblind from birth, most people don't know that they're colourblind. They don't know that other people see things differently. Being colourblind can cause difficulties when it's important to be able to see lots of colours, such as on a computer screen or in art classes. Boys should have their colour vision tested when other people in the family are known to have colour vision problems. If people on both sides of the family are known to have colour vision problems, then girls should also be tested. Colour vision testing can be done by optometrists using specially designed charts. Some school health services and some doctors will also be able to test colour vision.
Listening Part B. You hear a radiographer talking to a patient about their CTC examination. Now read the question.
Okay, so your appointment's scheduled for 8:30 next Tuesday morning.
That's great. Thanks for organising that.
No problem. Now, the main purpose of the CTC examination is to look for abnormalities or polyps in the large bowel with the use of a CT scanner. So that means 3 days before the test, you'll need to start eating a low-fibre diet, and then 24 hours before the test, you'll be drinking clear fluids and you'll need to abstain from alcohol. Then on the evening before the test, you'll need to take laxatives as prescribed by your doctor with several glasses of water. You also can't have any breakfast on the morning of the test, and we'll need you to be self-administering some suppositories at that time. But all of this information is set out in the letter. If you've got any questions or concerns about it, make sure you contact either myself or your doctor.
Okay, thanks.
Part B. You hear a physiotherapist speaking to a support group for Parkinson's disease. Now read the question.
The physiotherapist's aim is to maximise the patient's functional ability and quality of life. Physiotherapy can help alleviate symptoms like tremors, rigidity, slowness of movement, and impaired balance, which can cause abnormal gait and posture. It can also help with cramps and pain in the muscles, and even help patients who experience reduced fine motor coordination. Physiotherapists use physical treatments such as exercise to prevent or reduce stiffness in the joints and to restore muscle strength and mobility. As well as this, physiotherapists can supervise the patient's exercises to help maintain their posture and balance and advise the patient about ways of preventing or reducing the risk of falls. Physiotherapists use other treatments such as heat and cold or electrical equipment like ultrasound to help relieve pain patients may have. They can also advise or train parents and guardians of patients suffering from Parkinson's disease in safe and appropriate ways of helping them with mobility problems.
Listening Part B. You hear an oncologist talking with a patient about their test results. Now read the question.
Well, I'm happy to report that the colonoscopy has found no evidence of cancer.
Are you sure, Doctor?
I know you're worried because your father had bowel cancer, but your test came back negative, so that's a good result for you. And let me reassure you, we can see cancer if it's present in the colon in more than 90% of cases. So we miss very few early stage cases.
That's a relief, Doctor. It really is. But then we still don't know why I'm experiencing these abdominal pains.
Actually, we do. We discovered that you have something called diverticular disease. Have you ever heard of this condition?
No, I haven't, but it sounds pretty serious.
Well, if we follow the proper management, it doesn't have to be so serious. Let me tell you a little bit more about it.
Is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36.
You'll hear a lecture based on the subject of asbestos.
You now have 90 seconds to read questions 31 to 36.
Asbestos is a naturally occurring mineral rock that was mined in Australia from the 1940s to late 1980s and used in a variety of materials and products. Unlike other rocks made up of small particles, asbestos is made up of fibres so thin that they can be invisible to the unaided eye. If asbestos materials or products are disturbed, these fibres can be released into the air and remain for extended periods of time, where they can be inhaled to the deepest parts of the lungs. Asbestos is a group of naturally occurring silicate minerals that are made up of fine fibrous crystals. 3 of these are chrysidolite, blue asbestos, amosite, brown asbestos, and chrysotile, white asbestos. Asbestos was a desired resource for many companies because it is also relatively cheap to mine and process. Unfortunately, however, asbestos is also a highly toxic, insidious and environmentally persistent material that has killed thousands of Australians and will kill thousands more this century. Australia and the UK have the highest rates of asbestos-related death in the world. This is understood to be because of the amount of asbestos used in these countries and the relatively high proportion used of the most dangerous types, brown and blue. Asbestos was considered a valuable product due to its resistance to fire, moisture, chemicals and heat, and also its suitability as an insulation material. However, due to such devastating diseases in people, a national ban on asbestos came into effect on the 31st of December 2003. People may be exposed to asbestos in their workplace, their communities, or in their homes. If products containing asbestos are disturbed, tiny asbestos fibres are released into the air. When asbestos fibres are breathed in, they may get trapped in the lungs and remain there for a long time. Over time, these fibres can accumulate and cause scarring and inflammation. As a result, breathing can be affected, which leads to a serious health problem. Research has shown that there are several factors which can help to determine how asbestos exposure affects an individual, including dose, which means how much asbestos an individual was exposed to, duration, how long an individual was exposed, size, shape and chemical makeup of the asbestos fibres, source of the exposure, and individual risk factors such as smoking and pre-existing lung disease. The inhalation of asbestos fibres may lead to a number of respiratory diseases, including lung cancer, asbestosis, pleural plaques, benign pleural effusion, and malignant mesothelioma. Although exposure is now strictly regulated, patients continue to present with these diseases because of the long interval between exposure to asbestos and the clinical appearance of disease. Presenting signs and symptoms tend to be non-specific. Thus, the occupational history helps guide clinical suspicion. People particularly at risk are those who have worked in the mining of asbestos, especially blue asbestos. Other at-risk jobs include shipbuilders, insulation workers, fitters, carpenters and electricians. Immediate family members of workers are also at risk due to washing clothes which may have been contaminated with asbestos fibres, even though the amount of exposure is very small. Because exposure to cigarette smoke increases the risk of developing lung cancer in patients with a history of asbestos exposure, smoking cessation is essential. Patients with asbestosis or lung cancer should also receive influenza and pneumococcal vaccinations. The 3 most common asbestos-related lung diseases are asbestosis, lung cancer, mesothelioma, and I will now outline their symptoms, prevalence, and treatment based on a recent US study. Asbestosis. Firstly, people with asbestosis have symptoms such as difficulty in breathing and dry cough, and it affects approximately 200,000 patients, with 2,000 deaths annually.
You hear a physician called Dr. Hubert Johnson discuss improving efficiency at a healthcare practice. You now have 90 seconds to read questions 37 to 42. Hi everyone, my name's Dr. Hubert Johnson, and I've been asked to speak to you about my experiences in the healthcare industry concerning something that affects all health professionals, improving efficiency. It seems to be a given these days that practices will struggle with a lack of efficiency. We've actually found that this expectation in and of itself can reduce efficiency and increase delays even further. In a recent survey, when patients were asked why they arrived late to their appointments, 30% said that they had assumed that the previous appointment would run long. Patients expect to be kept waiting, and to some extent, we expect that patients will be kept waiting. And so the first thing we need to address is our attitudes and the attitudes of our patients. So let me start by telling you about the efficiency I observed in a practice I visited a couple of weeks ago. At this practice, patients could not make appointments online, but they could either phone up or make an appointment in person. There were never more than 2 receptionists working in the morning, and the practice generally scheduled 80 appointments each day. Patients who were not attending a follow-up appointment were required to make their appointment on the day of. Can you imagine what that practice was like in the first couple of hours they were open? The receptionists were inundated by calls and walk-ins trying to schedule appointments. As you can imagine, patients who had seen what the practice was like in the morning expected that if they didn't have the first slot of the day, they'd be delayed by at least 10 minutes. So naturally they arrived to their appointment 10 minutes late. One of the most important things you really must address in your practice in order to improve efficiency is the way you present your practice to patients. If they believe that you are always running late, guess what? They'll be running late too. Now let's think for a moment about what needs to be done on the patient's end before an appointment can take place. You might be thinking that there are only 2 steps to the process. 1, the patient books an appointment, and 2, the patient arrives at the practice in time for their appointment. Well, we healthcare professionals often forget that there's actually a step that comes before this. Firstly, the patient must decide that their issue is significant enough to warrant an appointment. So, about a decade ago, my practice was really struggling from a lack of efficiency. I was working extremely long hours to try to accommodate everyone, and I was becoming increasingly frustrated with conducting appointments that didn't seem strictly necessary. I got to thinking about how I might be able to help patients to reconsider their initial assumption when booking appointments and to treat minor issues at home. At the same time, I did not want my patients to feel unsupported. I decided that I would begin to give weekly presentations in the evenings about self-care. As I tended to see a multitude of patients coming in for similar issues that they could actually treat themselves, each week I focused on a different common theme. The presentations lasted for just 1 hour, but I found that they resulted in 7 fewer unnecessary appointments each week. These days, of course, I no longer have to give a physical presentation. Thanks to modern technology, I simply upload instructional videos to our practice's website. We also email these videos out to patients periodically. We can and should make use of technology as a tool in our practices to help us improve efficiency. However, it's important to note that while many, perhaps even the majority of your patients will be capable of using technology to arrange their appointments, there are many people uncomfortable or unable to use technology, so you must always make sure that these patients are accommodated too. Providing your patients with more options rather than replacing old options is often the best practice for improving efficiency. Now, let's move on to look at a practice that used technology in a surprising way.